Nurses have been standing on the front line as the world battles the COVID-19 pandemic. And today we celebrate International Nurses Day, and Union Hospersa is calling for increased protection against the coronavirus as well as a better remuneration. Well, to commemorate this important day, Union spokesperson Kevin Mahalama joins me now all the way from Pretoria to have this discussion. Kevin, thank you so much for your time and good morning to you. And I suppose happy, International Nurses Day to you and your fellow, colleagues in the field. Before we get into some of, the issues, whether pertaining to, the vaccine or even remuneration, let's just reflect on the year that was. How has this past year and a couple of months really been on the ground for nurses?
Good morning, Dumale. Thank you for inviting me. To be honest with you, it's been a very difficult year. As you are aware that in the clinics and in the hospitals, there's been a lot of challenges before COVID-19. We've had staff shortages, overcrowding, a lack of medication, corruption, maladministration, all those. And then COVID-19 came and hit us. That just exacerbated the situation on the ground. A lot of the colleagues lost their lives due to the contracting the COVID-19 pandemic. So while we celebrate the role played by nurses, today I think is also a bit of a somber day for a lot of nurses. Is a day that they reflect on the lost ones, the ones that passed away. Sorry.
Yeah. Absolutely. No, I understand, Kevin. And with that being said, the sense I'm getting is that there have been issues within the sector, even pre-COVID, with regards to perhaps even working conditions. Take us through, what working conditions nurses had to endure, as well as the staff morale that they had to work under.
I think one of the biggest challenges that faces the nursing profession is the staff shortages. There's been a moratorium on the filling of vacant funded posts. I think that's mainly been caused by the wage bill that the Treasury has been drilling, that it has gone overboard. But when you look at the health sector, it is really battling, Dumelo. There's a lot of vacancies that haven't been filled. And when COVID-19 hit, a lot of the nursing staff had to go in quarantine, which meant that now the ones that remained have to roll out the necessary healthcare services under critically short staff. Yeah. Even the PPE scandal, Dumelo, that was, I think, a very low point in that a lot of lives could have been saved had there been sufficient PPE, quality PPE that was procured for the nursing profession. And
that's exactly what I find quite sad and tragic, is that, you're also of this view that some of the positive cases recorded, especially in as far as nurses are impacted, and the deaths that we've recorded in as far as nurses are also concerned, could have been avoided. Should everything been done in a very transparent, in a very, moral way, which, of course, we wouldn't have then seen, the corruption, wouldn't have seen the lack of inadequate PPE that obviously the nurses had to work under during this past year at least.
Exactly, Dumelo. I mean, it was unthink of that people would use the COVID-19 relief funds to pocket and through corrupt means and procuring of PPEs. I mean, the reports that we've been getting about the PPE corruption has been shocking. And it is a bitter pill to swallow. I mean, if you've lost a colleague on the front line, it is kind of a bitter pill to swallow, because you know that had different processes been implemented, those lives could have been lost, could have been saved.
Right. I mean, Kevin, on the same breath, when we're talking about the working conditions, the issue around remuneration continues to be a factor for nurses. Has the call to, address issues around remuneration for nurses being heeded by government at this point?
Not at this point, Dumelo. We're still getting the cold shoulder in that we are being told that the wage bill is too high. But in the middle of a pandemic, when you have staff working in such a high-risk environment, surely, Dumelo, there is a bit that you can just put on the side just to boost the staff morale of those employees. It is really shocking that even till today, Dumelo, we are still battling to get government on the table to address issues like providing risk allowances for nurses, like even providing counseling services within the different hospitals and clinics, just to ensure that the staff morale gets addressed, and nurses go and give their best when they do their duties.
Absolutely. And we hope, of course, this day will highlight some of those issues and more. And, of course, we can have better communication with this. Thank you so much. Kevin Halama, spokesperson of Hospersa, joining us right there via Zoom.